instructor at Madison College. Sarah is a collaborative and creative ESL higher education professional who is passionate about health literacy and amplifying diverse immigrant patient voices in the healthcare setting. She is an ESL instructor at Madison College and specializes in contextualized and engaging ESL instruction, authentic assessment, and curriculum development. Brian Buttress is a project team trainer with Epic Systems. He currently teaches at Epic Systems, where trainees travel to Madison from all over the world, we all know how big Epic is, to attend his weekly classes and to learn to use and build with Epic's electronic medical record software. Please help me in welcoming Eric and Sarah. Brian and Sarah. Sorry.
I can be here. Yeah.
Where do we share it out?
PowerPoint here.
Perfect. Well, welcome to, should I use a microphone?
Yes.
Okay. Welcome to Patient Portal Practice. We are really excited to share with you what we created and some of the outcomes that happen because of what we created as we develop something that would build digital literacy and empower patients to navigate the healthcare system so that they could have a little more equal access to what they need.
There's also a nice little, there you go.
Do you want to introduce yourself again?
Sure. So Brian, trainer at Epic Systems. I train one of our revenue applications. And so I met Sarah through the University of Wisconsin-Platteville. I was working on a master's program in adult education. So kind of I stumbled upon health literacy, which is kind of a randomly assigned college class to teach. I just want to clarify, I do work at Epic, but this is not like in conjunction or partnership with Epic. I just happen to work there. So I do want to clarify that, like, don't call Epic asking for me as part of that.
So, yes, it was very providential that I got to meet Brian because I've taught a variation of health literacy for almost 15 years, usually in person and during COVID-19 online. And we normally teach about medications, going to the doctor, typical things in health literacy, but COVID-19 really changed that. So we were learning more about like vaccinations, all the things we needed to learn, except the students still needed to go to the doctor and everything was moving towards telehealth. So at first we practiced, obviously, because it's learning online, breakout rooms, pretending there was a practitioner and a doctor. But the students wanted to learn to message their doctor. And the students were struggling with this idea. How do we message? So if you can picture a class of, 12 to 15 adult learners from all different corners of the globe, some really highly educated but don't have English language knowledge yet. Others maybe have never used a computer and just got their own smartphone. So all different abilities in this class. And the purpose of the class is to build those language skills, but also in the context of health literacy. So I used to, no judgment, I used to take screenshots of my chart and I would black out the medications that I was taking or black out, like Sarah weighs 148 pounds, like whatever. So, so they could see that because I didn't know what else to do. I thought, how can I teach these students, a way to access it? Because we also know that with my chart or with the patient portal, with the patient portal, it's also much more affordable. If I message my doctor and I say, hey, Dr. Stein, I think I have pink eye, I probably don't have to come in. She can very easily send a prescription to the Walgreens. I can pick it up. I've saved a $25 copay, maybe more if I would have gone to urgent care. So I used to share my chart and I would just simply point on the screen. This is where I click to do this. This is where I message my doctor. This is where we can see the medication list. But it didn't allow the learners to really experience it for themselves. So I felt, truthfully, a little bit stuck. Before I met Brian, I approached Epiclandia about this and ran into some institutional barriers. I approached some hospitals through contacts I know and was met with a really great enthusiasm. People are like, that's a great idea, good luck. we're cheering you on. And I was like, yeah, but like I need some help. Like I'm a teacher and I'm great at it, but I don't know how to do this and develop this. So I felt really, really lucky that Brian and I met because I'd put it out there to the universe. Like I need this. So Brian is really talented at recognizing the needs and the functions of what students need to do online, and is going to tell us about a patient portal.
Yeah, and so just a patient portal in general. I'm sure a lot of you have my chart or are working to make it better every single day. And so it is an interface that allows you to view your own medical records, things like discharge summaries, after visit summaries, if your provider provides you with steps to continue to better your care, if you roll your ankle, elevate, ice, all that good stuff that can be in a digital format for these patients to reference on a regular basis. They can view a list of meds they have, request refills. I don't have to call a nursing staff and a couple of button clicks. I can request a refill. I can schedule appointments from patient portals, advanced check-in from patient portals to help save me time at the front desk, all the way to messaging doctors. I had a weird eye twitch back in like 2018. I was like, should I come in? Doc said no, give it a couple weeks, and it was cleared up. I'd saved some money from not having to go in, all the way to paying bills. It's the year 2022, online bill pay. I don't remember last time, I can't even find my checkbook, no less pay with a check, to where we want to utilize some of that more advanced technology in 2022 as well. So what I did is I kind of created a patient portal. And so I want to clarify, I have no coding or website design skills. I am merely a man with Weebly, creating a website that is mocked up to look real, kind of like the old Wild West movies, where it's like they walk down the street in the Wild West and it looks like there's a saloon and a general store, but you open the door, there's a bunch of 2x4s. Kind of the same concept here with the website I designed to really say that's something that if you wanted to incorporate in this classroom, you could do it too. I was intimidated when I was assigned this task of can you create a patient portal? I was like, no, I don't take any coding classes. Every once in a while at work where developers pull up code, I don't know what that is. Looks like someone sat in the keyboard to me. To where I want a nice interactive workspace to where I could create a website that just gave them the ability. Now I don't want them to actually message their doctor or actually have real life medication and test results on there, but something fake that they can use to investigate and to merely practice. And from a standpoint of being an educator, from an assessment standpoint, to let us know they did something. And so when they request a refill, I still under my email account, I still get emails of people, of her students saying, hey, I am Colton and I have been struggling with my eye twitch. I'm sending a message to my doctor. So we're going to just send you an email, and that can be your assessment piece. And I want to show you what it looks like. And so you can either pull out your camera phones. I'll get my head out of the way here. You can use the QR code. It's also in your guidebook as well. If you go to the presentation, there should be a link there. So working for everybody? Got some thumbs up across the room? Great. I'm going to make some of you use it here in a second. Or you can just type in the URL. That works as well. In the guidebook, if you pull up the slide, you should be able to click on the link for it as well. Because then I'm actually going to open it up here myself. It looks like we're presenting on a separate screen. There we go. I'll use this to pull it over to where you can take a look at it, poke around with it, where it truly is my attempt to create a patient portal. I started with, I created this back in April of 2021 when the vaccine was just rolling out. So I was like, let's provide vaccine information. And my chart had that big, unnamed patient portal had this big banner that said, don't call us about the vaccine because it was so new. We'll reach out to you. Where I'm like, I'm going to include that on my website there as well. As well as that traditional health information. So demographic information, that's really important as a patient, whether I'm on the billing side, so making sure they get sent the appropriate billing information. Also used as an important data element. All the way to allergies and upcoming appointments, kind of the high-level stuff that you would see on your homepage if you logged into a real-life patient portal. And not only that, But we also had things like appointments, to where I can use this website to see future appointments. And not only does it show me future appointments, I try to give folks a little hint here where click to drill down on dates, where they can advance check-in, where they can say yes or no, that I'm going to attend this, and the common things that you would see in the patient portal when doing an advanced check-in, like address information, email information, all the way to viewing prior visits. We'll click on March 1st. Looks like here's an after-visit summary where this patient from Dr. Connor Fieldhouse stretched 3 times a day for your sciatica. And not only that, but you could utilize this in your classroom as a way to, here's the website I want you to use. Or you can bake in some of the resources that you want your students to use in your classes. I even threw in a chance to request appointments, where they can click on request appointment and they can fill out the same type of information that you would see in your own patient portal. What doctor you want to see, what day of the week, what time of day. And all this does, ooh, didn't even click it. There we go. All this does is to send an email to whatever email you have on file. So whenever you as the educator, your email is on file, you can see that you'd want to have them put their name in it somewhere, which they can put their real life name on it, and you can use that as a way to assess. Did they include the right information? Because a lot of the folks, as Sarah mentioned in her classes, struggle with the English language, where they're the immigrants new to America, and we want them to use this new digitized medium of contacting their provider, signing up for appointments, stuff like that. Then, of course, things like test results. I threw in a negative COVID test there, strep test, medications. Not only can they view the meds they're currently on, but they can do things like request refills as well, which all it is in the back end is just built out like contact us forms. And I just changed the fields instead of saying contact us to what's your first name and what is the prescription to be filled.
Can I interrupt you?
Of course, go for it.
The really powerful thing about the forms that Brian created is so many of our English language learners, they get stressed about the phone, even advanced speakers who've been here a long time, because so much of communication, as we all know, is facial expressions, body language, looking to see if we understand. So the phone, for many, many, still remains this really heart-pounding thing. And also understanding on the phone, listening to what have I heard. So the forms on the patient portal are magical because the student can see, did I spell my name right? Did I ask the right question? They can maybe use Google Translate and cut and paste a little bit, which is great. And they also have that think time, that time to think, to read and respond. So the forms are super magical. Of course.
I have an idea and a question, kind of. Do you have a way to transition this site to a different language? Like if there was an area over in the corner that said, what language do you speak? And then it would just automatically change the format of the website to the language of the end user.
I bet you could build a separate page, like a sub page, and just have it say like switch to Spanish, and really all it would do is like it looks like it translated, but it could move you to the Spanish page where the same exact stuff, it's just you'd have to type it, you just have to duplicate it, and it's really easy to duplicate in Weebly, the same page, just duplicate it to a Spanish speaking instead.
Yes, and then you
great
can
idea.
create the link, right?
Yeah, you just create the link and
create the link and it directs you to the new website, and then I understand.
yeah. So it's like it's all about trying to make it seem as real as possible, but all it is just links to other pages. Yeah. Cool. And so just the last little bit here in terms of the website, I also added like a contact us, just like you'd have a way to message your doctor. And not only did I create like a contact us, like message your doctor form where they can include information, but you can also bake in like some of your learning objectives to where I said, for this independent exercise, answer these questions. So if you like assigned a research project of research a certain illness, you can give them prompts of what information to include in that message to their doctor as well. So I'm gonna give a brief demo there, and I'll have Sarah talk about some of the cool things you can do with it.
Awesome. And so this is such a rich website. You could do classes and classes on medications, what to find. Some things I did to meet with my educator brain, some of the class objectives is to build reading skills with skimming and scanning. So oftentimes, English as a second language, non-native speakers, they will want to read every single word and maybe translate every single word, and we know that there's not time for that in our lives, right? Nor is it meaningful. So teaching those skimming and scanning skills in the way that Brian built it with the bolded, the headings, what to look for, looking for the top with how it's laid out, what's a hamburger menu, what's a drop down. So teaching those skimming and scanning was great. So I made different Google forms, little web quests, scavenger hunts. What do you click on for this? What do you click on for that? Take a picture of the page that gets you to here. I had them do it sometimes in partners in breakout rooms because we were all online at that point, and then sometimes individually. I really love problem-based learning because usually we all have problems in our lives and need English language to solve them. So a lot of exploration exercises with problem-based learning. The idea that you want to request a refill. How do you do that? You want to message your doctor that you want a refill, but you want the generic version because the one you're on is too expensive. So creating these problems and then scenarios and letting the students figure out how to solve them and then bringing them back and having them tell the rest of the group how they solved their problem. Brian shared a little bit about the next one, linking in those documents, linking in documents to, I think you had the PT exercises with the sciatica. You like put a,
Oh, yeah.
So like having them go, okay, like this is the follow-up that you can do. Having them read through that, see if they can find it. And then seeing also about COVID-19 or updating it for other things that hopefully won't come to find us. The researching a disease, that is an assessment that I've done for a really, really long time in health literacy. Having students self-select either a common illness or some illness that is, or disease that is meaningful to them. I want it to be related to what they want or what they want to learn. Sometimes students pick the same thing, usually no. And then they have to research. There's like a rubric, research the symptoms, how would you describe the symptoms, what causes this, all these different things. But having them do that research through reputable websites and then inputting it through telling their doctor, hey, I've been researching this. These are my symptoms. What do you think? And sending that is really interesting and a meaningful way to use it. The most powerful part is that all of this, when they submit the form, it's like a test, but it's better than a test because it's not a multiple choice test. It's an authentic assessment of their abilities. So that's what I love most because nobody likes multiple choice tests.
No, I can attest to that there as well. It's definitely a more interactive, authentic experience that you're looking to aim for. So I figured I'd give that all to you as well. And so you all had or many of you had the website open. Here we took some actual activities here that I had in class and that Sarah continues to use. So I'll give you about 2 minutes. You can choose either one you want. You can be Colton with a bad back or my mother-in-law, Melissa, with the eye twitch. So I'll give you 90 seconds to work through it. Put your name in there somewhere because I'm going to read it out loud from my phone because that's where I get all my emails too. Let's give it 90 seconds or so. Set a timer. Sorry. Blowing up my email queue.
So those of you who aren't language teachers, if the standard rule in language education is if I'm prepping a lesson and the activity takes me 5 minutes, it normally might take my student that's intermediate level 45 to 60 minutes. So what you're doing right now would probably take about half an hour in our class.
And I've received about 15 emails already. And so here's what it'd look like. So I appreciate your engagement. Here you can kind of get a view. I know it's kind of big, probably hard to read, but I wanted to leave in like you receive it from the no reply at Weebly.com. But I have a Brittany Thomas. Yeah, from the University of Iowa. I have an eye twitch. I don't think it's contagious. I don't have my left eye. I'm worried it's an indicator of too much stress. Should I say a doctor? And so it's that instantaneously message to me. I could use this as an assessment there. Let's see if I choose another one here. Julie Turkosk. Yeah. I have an eye twitch. It usually happens in the morning after coffee. Do you think I should make an appointment? So as simple as that was there, for you to, for one of her students, so that's obviously going to be a lot of work, is not only finding the right page, but kind of knowing how to put that into words is a nice interactive activity for them. And this is what I see on my end, which my college email is running out like 2 weeks from now, so we got to switch that out.
Totally. So it gives so much power to the learner and the consumer, because instead of having to call and you get the receptionist at the office, please wait, and then you listen to the horrible hold music. Sorry if anybody chooses that music. And then you have to wait to speak to the nurse or leave a message, and then a different nurse calls you back. Very, very time consuming and very, very hard. Or if somebody doesn't know how to navigate our system yet, maybe doesn't think it's contagious, but isn't sure and goes to urgent care, so much more money. So here's a great way to also embed teaching something really important, which is navigating our crazy US healthcare system. Oh, it's me. So the goal of the class, most of the goals of the class can now be met using something like this by reading online health information, writing messages, seeing that the learners understand and can respond to it. Sometimes having peers look at each other's work before they hit submit. For really basic learners, I'll be honest, it's hard. But even just typing their name, typing their phone number, making sure that they have their birthday right with the month first and the day second is huge, 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 huge. And listening and speaking, although this is a text-based activity, listening and speaking and partner sharing in the problem-solving tasks as a group. What should we do? Should we request a refill? Can also be a really powerful way for communication as well. Can you click it?
Yeah.
Okay.
And so I figured I'd show you kind of what it looks like on the Weebly side of things. Like I know, like I mentioned, I work at Epic. I am not very techy. Like whenever I download an app, my wife always likes to explain kind of how does Instagram work? We had that conversation. And so I'm not that techy. I'm okay techy for someone my age, but not the greatest, to where I could put this website together. I think I stole like a Weebly's like restaurant theme and just swapped out, like instead of like appetizers, I swapped in medications and swapped with a picture of the cheeseburger with a stock image of a doctor. And that's all there really was to it. It's honestly a lot of sub-pages. Like you asked about switching languages. You could have it switch to a different language to French and have it go to the French page or Spanish or back to English there. So there's a lot of, it's more time-consuming and monotonous than it is complex, to where it is a lot of copying the same page over and over again and just swapping out. Instead of June 17th, it's May 1st for the future appointment time. And so I'll even kind of show you what this looks like here, to where I'll try to look to the side here, move my mic for me, so I don't have to have you hear me in and out too much. But from a Weebly standpoint, how many of you used Weebly before? I think it's a pretty common like educator tool. When I went to start building a website, I was like, I used Weebly in my undergrad like 10 years ago. So like, I think I built like a 4th grade unit on the skeletal system, and it's like my e-portfolio for like becoming a teacher, essentially. To where I used kind of my knowledge of that to where I'm just going to start here. I just started and started building, and eventually through trial and error, it came together to where it is a lot of subpages. So we talked about like switching languages. I could have the English version and then a subpage there for Spanish and just link to each other's pages. But I figured I could just show you something as simple as like adding a medication. So if I go to our medications tab here, on the actual build side of things, I can see that here the prednisolone there and the other med, to where all I have to do is, let's see, where is my text box? Text, drag that, create a full line of text, and I'll type in something like insulin, inject 2 to 4 times a day, pharmacy, CVS Health, West Side, prescribed by Dr. Bernstein. Matt Bernstein's my favorite Badger of all time, so I just kind of had fun with the names too there. I like to make the text a darker color, easier for your students to see. And I'll make that black. And then it's just adding some dividers to create the columns. So if I add a divider to the left side, and then add a divider to the right side of it here. Got my head all the way turned. There we go. To where I have my separate columns, I can do things like adding an image, and then add a button. And you can customize how a lot of these images and buttons look, to where if I want to customize the button text, I can say, instead of it saying button text, I could say something like request refill. And now it says request refill. I like to make the buttons really big, just because it's easier for your students to see. So I choose usually the biggest option there. I like to center it. For the linkage, so this is how it knows which page to go to. You could have it linked to a separate URL if you want to build in documentation. I'm just going to choose the option here for standard page, which just means any kind of the pages that I have built out. And for all those meds, I have the same exact request refill screen. So you don't have to reinvent the wheel a whole bunch. Just have it go to the same place and leave it generic enough. To where now I have my link built out, my button. I like to center it so you can use the top margins to push it down just a little bit. As for the image itself, here's where I'd like just Google like stock images of needle or insulin needle. I just, because it's not my computer, I searched for medicine and I favorited just this generic prescription image. In real life, I would find a nice image to represent the insulin. To where now I have my image, the description. I usually delete these horizontal headers above to make the screen a little cleaner. And that's all there was to it. To where I just click publish, go back to my website here, give the browser here a nice little refresh. Go to my meds tab, and now there's one there for insulin. And you could, of course, clear it up and make insulin bigger there and create links to learn more about insulin if you wanted to. I just, quick little demo here for you all to see that really, there isn't a whole lot to it. It is just a lot of monotonous, repetitive work. Sit down, I put on a basket, I think it was March Madness when I put it together and put on a couple basketball games, and a few hours later I had a fake patient portal.
But the payoff for that few hours of work is huge, Brian. So huge, because probably 30 hours, maybe more, of instructional time that the students have practiced. So it is, at the beginning, the click, the pasting, the copying. Thank you. It's been awesome. Yeah.
I'll loop you back to the PowerPoint here. I think you have another.
Oh.
Yeah.
So feedback from learners has been great. It's really improved students' confidence in communicating with the healthcare providers and just navigating the systems. But some specific stories are I have a particular student who often gets very nervous about illness, and she messaged her doctor after actually a Wisconsin health literacy presentation about diabetes. She was very nervous about that she may have this or that her blood sugar, so she messaged the doctor. The doctor had her come in for an appointment and did a test, and then she told me she could see her results on the patient portal that her doctor uses and that she was okay. And she was very proud that she was able to initiate a visit and ask for that and then look at her results. So that was great. Another family, a dad messaged about his child and having an appointment. And I really like that story because so often, especially with kids, our learners, they just go to the hospital or to the urgent care because they're worried and they don't know. And I thought, wow, this is a wonderful thing that they can do. So we want to know what reflections or questions you have about either our experience, things that you think we should add or change. We love feedback, so go for it.
I'm wondering what students of diverse proficiency levels struggled with, what they found difficult, and then how you built accommodations into the work.
Excellent question. So my classes are normally multi-level, so beginner all the way through intermediate. So for beginner, truthfully, the biggest part was usually just the idea that it was digital literacy, and during COVID that I could not sit next to them. So that was the biggest barrier. So what I would do is I would take screenshots, or I would show them in real time. I would share my screen and say, this is where I'm going to click. And then we would pause, and then they would do it on their own for beginners. So that was just a lot of looking for where to find information. For writers, the writing isn't always super, So sometimes, the emails that Brian would get would not have great spelling. So then it's a conversation point. Things like that. How do we spell check? What does it mean to look in your phone and copy and paste it in there? Things like that. Does that help? Okay.
I think also you could do like the same like medium for like the various levels too. That could be like an instructional point where it's like for the young group, for the basic folks on the lower levels, have them get in the basic information, and for your advanced levels, maybe even have them reference a source or just have it a higher expectation utilizing the same medium.
Exactly. Like skim and scan might take 2 class periods for a beginner, but the advanced could do. Hey.
Awesome, guys. I have a quick question for you. How did you teach your students what a reputable website is?
I'm so glad you asked that question. So I taught my students what a reputable website is through the help of Wisconsin Health Literacy. So there was a presentation on what makes a good website. And the presentation was Wisconsin Health Literacy's presentation, which is fabulous. If you need them and haven't had them, I encourage you to partner. But also, bye, thank you for coming. But also, I had them look at different websites kind of in the middle of the presentation. I built in an activity because sometimes with the health literacy presentations, they're not always for an interactive class. And I like my classes to be interactive. So about 2/3 of the way, there's a point where we made like a mini assignment where they would go in breakout rooms and look at different activities and research together. What do you find? How do you know if that's an advertisement or not? And then with their presentation, citing the source of where they got it from and not Wikipedia or WebMD.
Awesome, okay. This one is more for Brian. Brian, would you liken your training site here to like an epic playground, but for patients?
Kind of. As a trainer at Epic, we have our playground environments to where it is fake patients, fake data, and I always tell my students to treat it like a new app on your phone. I just kind of poking around, playing around. Instead of asking like, hey Brian, what's this button do? First, I just want you to click on the button to where they can do whatever they want on this website or in an Epic playground to where they're not going to break anything. It's an opportunity for them to explore to where I could see if I was a real life patient in real life my chart, hesitant to send a message, I would have a lot more anxiety about that message being perfect to a real doctor than maybe I give it a fake test run, or I just learn that it exists throughout this process. So it is a very similar concept to an Epic Playground environment. It's just, instead of using a server on the Epic side and the Epic platform, here it's just a site I built on Weebly.
That you too can build on Weebly.
I just want to add that helping students learn that skill of clicking around and not being afraid of breaking something is such an important digital literacy skill. So
Yeah.
you've really built that in too.
For sure, I love it.
Y'all need to get closer together.
Wear your running shoes.
This is great. I also teach ESL, and I've wanted to do this for a long time. And like you, I said, yeah, I'll do it, but I don't know how. So logistical questions. So you're in a classroom, you get into breakout rooms, they're sending the messages, and he gets them?
So Brian will get them. You can input whatever email that you would want. So Brian was in almost all of my classes last spring. Yeah,
Few of
because
them.
Brian was finishing his master's. So we were partners. He was the
Okay.
student teacher in my class.
Basically, we just need to update the email address.
But you
to go
got them
to.
too?
I can get them too.
Yeah.
Yeah.
Okay. And then so when you were showing us on Weebly, then those links go to the email.
Yep, and so in that
So when you put a
contact
button
us,
in, because I never did it.
Yeah.
Okay.
you determine which email address it goes to. We just because I eventually built it for myself when I was teaching the class, we just haven't updated it to be her email instead.
But
you
Brian's
should be able to
great
update the
about forwarding
contact
them.
us form. So it's just
So
laziness
can
on
we
our
keep
part.
yours and yours? No.
But no matter which button, it always goes to the same place. If you click the contact us form, it'll just send the email. If you click the request a refill, it'll send an email.
Okay.
That's what it does.
Okay.
It doesn't go to like a site or anything like that.
It's been a while since I
Okay.
poked around the contact us forms, but if I just pull it up here,
And I guess my other question is, so do you find that they're actually using their real patient portals then? And, they're all laid out a little bit different, and they're on the phones a little bit different, but it generalizes well enough?
I'll let you speak to that one. Oh, you're good.
Maybe.
So I have found that it generalizes well enough because for me, my chart updates depending if you use multiple health systems. Each one looks a little different,
Yeah,
right? Or
absolutely.
you log in a different day and you're like, whoa, something changed. So
Yeah.
I'm honest with them that it's something that we all have to learn and we're all continuously learning. Now, Brian and I haven't updated the page and then surprise them, like surprise, because I feel like that's too big of a
Yeah.
push. But I found that it generalizes great because Brian, I think, really thought through. We had conversations at the beginning with the end in mind. What do I want my students to be able to do? Request a refill, all those different functions, and those are the ones that Brian built in. So we're honest that it may look a little bit different, but all of those things, these are the keywords. The keywords
Yeah.
are almost the same that you have to look for.
So you really have to focus on the keywords rather than you look over here or,
Yeah, the keywords prescription, request a refill.
Yeah.
Now the really big, the pay a bill. The students always hate that one. They're like, oh, I think it's $346 because they always complain about it. And then the e-check-in is something that a lot of clinics are really pushing for. That I don't personally love, but whatever. But practicing how to do that and updating their information ahead of time because that's a really hard conversation as a language learner to have.
Yeah.
So.
Well, thank you.
also-
This is great.
I love it. I also generalize the dates too. So instead of putting like June 17th, 2021, like you can not have to update as much. Like if you wanted to be like up to date, like ours, it just happened to be a year to where like the future visits were in May, in June, where if you don't put a year at the end, you don't have to like update it every single year as well, which can save you some time.
Hi there. I have a question / comment / feedback. It's a blend of all three, but I'm thinking that a lot of English language learners and communities of color building that trust with a provider is definitely necessary. Was thinking if there's opportunity to have maybe some content on there that can lead to your students like having a test that's inaccurate or disputing a result possibly with a provider or having some information that isn't necessarily, that's wrong, that's initially wrong, so that perhaps they can practice having these more technical conversations with their provider and discussing more medical terms, since a lot of these communities don't necessarily have that language to have clear discussions with their doctors. or have the maybe lack the vocabulary to have those conversations. So this could be a really nice opportunity for them to practice in maybe a safer space. So.
Yeah. I think two things came to my head right away. Maybe even building out like, who is your doctor? Like, like when I go to like search for dean, I'm like, primary care providers who are male. Like I see like a bio. It's like, he loves sports. Like I'm gonna go to this guy or this gal. So it's kind of like how you pick a provider, as well as you mentioned the dispute. I'm a biller at heart. I work on our professional billing team, to where I almost see like setting up when you go to the contact us form, having one link be like, send a message to your doctor, and then another link maybe customer service message, where it's the same contact us form, but instead it's, I would like to dispute the MRI that I never actually had, to where it can be a similar contact us form. It's just a different theme or a different reason why you're contacting. And that could be really, all I gotta do is copy and paste this page into another one, instead of saying, message your doctor, message customer service. And you could include those same prompts that we had above, where it's like, what did my statement say I have? Or what did I think happened instead? And you might be able to link that from the billing page too, where it's like, got a question about your statement or your charges, go to this customer service, contact us. As a way to build on top of that.
I think too, I love that idea. And I love the idea of doing it with adding those buttons and then problem-based learning. Saying, adding a button even for patient relations, saying, I feel like maybe in the after visit summary area, contact patient relations, and then having a blurb for our learners. What is patient relations? What do they do? If they feel they haven't been treated well or something like that, or some feedback for the organization, and then giving them common situations or problems that I would probably need to reach out to some students to find out what those are, and then give those as little problems for groups to solve. And then, of course, how to word those professionally. Mm-hmm. Great idea. I love it.
So I'm sorry if you already mentioned this. I had to come in a little bit late. But I imagine in your class you have a wide range of digital literacy skills. How do you determine what you kind of need to teach up front in order to be able to do this exercise?
Well, I think Sarah 2 years ago would answer that really differently, because with COVID-19, they're learning on the computer. So I already know that they can log on to a computer or a smartphone. So there's certain things where before this, I wouldn't have taken for granted, because some students wouldn't have known how to do that. Things that I find are particularly tricky that I try to find out ahead of time are, can they open another window? Do they know what that is? Or like different words, password, login, minimize, that the X means, so sometimes we do just a quick cheat sheet review just in all of my classes in general. The X means that it will go away. The red box means I will disappear, all those things. Does that help? Okay. Anna's getting her steps in.
I need to get a few steps in as well. I have a question, comment, just something that was sort of going through my mind. And I'm just wondering if you get into any of the other sort of HIPAA-related sort of issues or nuances and things like that, with your students. And if you do, sort of how you sort of blend that in. For example, a parent who maybe has a preteen who's 14 wants to request something, and the clinic has policies around that, some of those maybe more nuanced things. And then I also was just wondering if you've ever done something like this more like for the elderly. I think my parents could really benefit. Here we go.
I have thought of that MyChart or that patient portal problem with the ages as a problem to solve, especially because, I have a 19-year-old. I know it's like to go through that, and it can be very, very confusing, which things you can see and not see. I don't teach about HIPAA with this lesson, but I do teach it at the beginning of this class, because in the higher education system, we don't have HIPAA, we have FERPA. So it's really similar. So I kind of explain, like, if your spouse calls, I can't say that you're in class. Like there's only certain information I can give them. But with HIPAA, I can't even give them that information at all, which culturally can be really sticky.
Cool.
On my way over, I'll just add, as a literacy provider, if you work for a literacy agency, it's really important to stress with your instructors or your tutors that what you're doing is you're teaching the language and the communication to talk to your doctor, that you're not actually offering health advice. And so, making sure that you put that at the forefront. Now I forgot who I was walking to. Okay, here we go.
Thank you. So, I mean, just with us playing with the website right now, it obviously works on multiple kinds of devices. And there's a cell phone version and a computer version. When your students are in class, are they all on computers and navigating the computer website together? Or do you have some students who are on phones and some students who are on computers? And how do you kind of juggle giving directions for both of those things?
We've only taught this class virtually. And I think this is, in summer, I have my 5th go of teaching the class. So usually after the 3rd, it gets a little bit better. Not always better, but a little bit better. So usually I start with the show me approach. So I say, this is what a patient portal is. We go through it together, much like Brian did with you all. And then after we go through it together, we may do, depending on the level of the group, like a scenario together, like, oh, what would we click if this were the thing? And then the students do that skimming and scanning scavenger hunt by themselves. So usually I have them do it in a breakout room because sometimes the students don't like when you feel, I don't know if you felt like this, like you're staring at them while they're working. So it feels kind of strange. But so far they've been able to do it, and that's been positive. What thoughts do you have, Brian, on that one?
I think you hit them all on the head, yeah. Fortunately for Weebly, it has a really nice smartphone design as well. It's pretty much the same. Maybe someone with more skills than I could put an app together, but then you did an app, it might get into intellectual property issues. Here it's just generic enough. I even ran it by our legal team because I didn't want to get sued either. They're like, yeah, it's generic enough to where you're not stealing any kind of patents or whatnot. If you make an app, that might get in some more hairy issues. Yeah.
Hello. I don't know if this would be possible at all on Weebly, but have you ever thought of having a tab for setting up a video visit? I know with a lot of telehealth care, sometimes checking to make sure that your microphone is on and your camera is on can be difficult. And so that's something we've worked on is what kind of language should we give if your microphone isn't on, how to instruct someone how to turn it on. So I don't know if something like that would be helpful to have or interesting, or if that's possible to do on Weebly.
I don't know the integration between Weebly, especially the free version. I think you have to look at some Weebly, what you can and cannot do. If all else fails, I bet you could put in a Zoom link at the very least. If click this link to open up Zoom and click this phone, whatever your Zoom phone number is. That's the first thought that came to my head. I know there's an upgraded version of Weebly where you might be able to integrate a Zoom or a Skype or something like that to make it seem more realistic. Or maybe even embed a YouTube video where it's I'm sure there's some kind of role play doctor telehealth on YouTube where it's sure a visit, but how are you today? And then maybe they pause for 5 seconds. It's going to be interactive conversation. So that's the first initial thoughts that came to my head. That's definitely a good thing to push is the telehealth visits.
I think it's great. And
COVID.
every interface is just different with the check if your microphone's working. I know there's one that a particular clinic in town uses that I still have trouble with, and you have to speak into the microphone. But I think I like your idea. Just making a video or showing pictures about this is what it means, or the fact that you can, how to find even that navigating, how to find a phone number instead. What if you can't connect and you're like, oh my gosh, it's my visit time. What would you do? That kind of, so that's a great idea.
I was just going to say earlier, someone had asked about whether you could have a Spanish version of the pages or any other language as well. I work with EL students in high school, And the great part about technology is there are so many add-ons now that they can actually put on and convert their pages automatically. Any web page converts to any language that they choose. So my students that struggle like in a math classroom, even if it can be given to them on a web page, can immediately change it so they can read it, so they can still fully participate within that classroom. So that is the one nice part. If we can help them learn how to navigate this system, if they can do online check-ins, then the language isn't a barrier because they can use their devices to change it to what language they're comfortable with too while they're learning the English language.
That might even be like a good tool to promote to your learners as well, to where I imagine the average high schooler probably has better tech skills than the average person in your class, to where almost not only promoting health literacy but also digital tools.
I love that because Brian has made this so thoughtfully with bolded text and simple, but we've all been on like the other apps and they're so filled with all this stuff. So teaching that skill of, hey, like this is the add-on you can use when you really do your actual one, because this can help support what you've already learned.
That's all we got. Any other final questions for us? Appreciate the questions. That was very engaging. I love the thoughtful responses and feedback.
It gave us lots of good ideas.
I have a question. So you had, on the slide, had asked about what we would add to the portal. And is there a way, so for me, when I go on, finding like the email address and then also toggling between, or not the email address, the inbox. So like finding the messages and then toggling between my account and my children's account can be kind of confusing. Do you have anything like that in the portal?
Not currently, but I bet you could build get like the sub pages for those appointments. Just build some sub pages on top of each other of where I bet you can have like a patient page hub. It's like patients I'm a proxy for, and then have like yourself, and then like your 3-year-old Teresa, and then like have a prompt like click on this link to view their information. To where you could really just build it on top of each other on what it currently has, and just you could duplicate the existing pages that you have for the one for yourself, then create those for your 3-year-old and just change the data that's inside of it. I don't know what it looks like so far in my chart. I haven't poked around the proxy. I don't have any.
No, that's
any kiddos,
exactly what I was thinking. Is I would put a stock photo of a cute child, and then click on it and say, "Would you like to switch patient?" Because sometimes it asks you, like, "Do you want to do this?" And then I would keep the template because it would be a lot less work, and just change the names of the medications and the doctors.
And then one other thing is where to find the portal. So like when you go to, like if I go to my healthcare system and then, you know, do I log in? Do I like where? So is this something like you just start at that point, like you bring it up and then, so maybe, I guess maybe you could pull up different healthcare providers and show them this is where you find it here and here. Or, I mean, I guess you wouldn't have to
And on your
specialize it.
phone and desktop, it looks totally different, right? Like looking at how that would look different.
I'm sure like if you upgrade like your Weebly too, you could probably even build like a unique login too, where it's like just add an extra step of logging in, because that can be hard for folks to where like you maybe have them create their own accounts inside of it. I haven't paid for Weebly, so I don't know the extent of what you can do with the full Weebly functionality, but I bet there's some login you could do. Create their own.
Any further questions, comments? All right. Oh, we've got one more. Okay, I'm coming.
Thanks. I was just thinking of one other thing I might add, because I know something that my students, I don't think all of my students know that they can request a doctor. And like not just, like even if you don't know somebody's name, you can just put in there like, I want to see a woman. That's fine, you can say that. So I might have a page with like, 3 fake doctor bios and say you pick who you would want to see, or put in that information when they're making their appointment. I think would be good.
That's
a prompt
great.
to think about, yeah.
And then that could lead before they even get to that. A cool lesson could be, what do you value in a doctor? What would you look for? What's important to you? And everybody would have different speaking and listening answers. Cool idea.
You can definitely build drop downs too. Like we had the drop down for days of the week when requesting appointments. So you could build up the various characteristics and male or female or certain specialties, kind of whatever you like to build into your activity.
How many of you would love to see this presented at senior centers for our seniors? Oh my gosh, how helpful would this be? My mom never learned how to use the VCR, so this would be so fantastic. Help me to thank our new friends, Sarah and Brian.
Thank you.
Thanks, guys.
Yeah, of course.
We have about a half an hour break, so get outside, get some